Hello and welcome to Ask the Expert. From medical questions to questions about surgery or just debunking myths, there are numerous medical questions we've set out to answer for you. For the past several years, 7 News, in partnership with Bon Secours St. has been getting answers to your questions. From the simple questions like how to get better sleep to the more complicated ones concerning cancer and screenings. This is 7 News' Ask the Expert. Let's take a look.
Patients will come in with a variety of concerns or complaints.
From what is my diagnosis to how often should I take my medication, Dr. Sharif El-Abari has seen and heard it all through the years.
A lot of them just want to know what tests they need, if they're doing everything right or what needs to be checked.
They're some of the most common questions and concerns asked by patients that El-Abari says primary care doctors can help with.
Primary care, we do a variety of things. We're kind of your home base, and we help with regular colds all the way to chronic diseases. We definitely recommend people get involved in their health care and try to learn as much as they can.
But doctors say to be careful where you get your information.
Sites like Mayo Clinic, WebMD, Healthline, those are good sites that have valid information that are well vetted and written by professionals. When you get into things like Reddit and Facebook, there's a lot more kind of risky information or potential misinformation, and I wouldn't put too much faith in.
While self-diagnosis based on online information is tempting, it can be unreliable, which is why they say getting your questions answered by a trained medical professional is important.
I mean, if it's worrisome, like if someone's having like a pressure in their chest, it could be acid reflux, it could be arthritis of some sort, it could be a heart attack. And so how do you know? And a lot of times we don't even know unless we do more tests.
Sometimes they'll refer you to a specialist for further evaluation, but the first step is meeting with a doctor to get to the bottom of your concerns.
And that's where, the education and the experience really comes into play. For coming to see your physician, they can help you pick out what's serious and what's not.
For this week's Ask the Expert, I'm Kelsey O'Donnell. From paper to high-security online platforms, the way health records are stored has changed.
In the past, medical records were kept on paper at different offices and hospitals in folders and files, and in present state, everything is kept electronically for the most part in a secured portal.
Julia Padawano is a nurse practitioner at Stoneview Internal Medicine. In nearly 2 decades of practicing, she tells us she's seen the evolution of storing records shift to computer systems and sites like MyChart.
Electronic health records is all of your medical information in one place. So that's your lab results, your test results, including x-rays, CTs, MRIs, notes from all your doctors, your medication list, allergies, immunizations, anything you've had done from a healthcare perspective.
It's not just your medical history that's stored virtually. Technological advancements allow you to interact directly with health experts by simply clicking online.
You're welcome to schedule your appointment for primary care, reschedule appointments, check in if you need to, update your insurance, pay your bill, read your notes, request refills, or just send a message.
But a big question that remains is security. How are major hospital systems assuring personal information is not leaked?
There are safety parameters built into electronic medical record, including 2-factor authentication for patients and lots of safety firewalls for physicians and APCs, nurses, clinical staff.
While times have, for the most part, moved away from pen and paper, it's still around. And if you need to get in touch, you can still pick up the phone and call. For this week's Ask the Expert, I'm Kelsey O'Donnell. With more than 1,500 mobile health clinics nationwide, researchers with the National Institutes of Health say over 5 million people are utilizing their care. That includes hundreds of people in our very own backyard.
We actually go across Greenville County and outside of Greenville County, and we're now at 36 different site locations. We go to churches, we go to government organizations, and other community organizations within our community.
Like many hospital systems, Bon Secours' team of healthcare professionals offers more than just in-office care. They're on the road, expanding available access.
Mobile healthcare is essentially primary care on wheels. We offer a variety of services from preventative care to acute care like sore throats, earaches, UTI, as well as chronic conditions like diabetes and high blood pressure.
Experts from the National Institutes of Health say the clinics provide an efficient way to deliver medical services to at-risk populations and, in many cases, provide care to those who may not be able to afford it.
One of the special things we offer is providing accessibility. So we are able to bring healthcare to our most underserved communities. We're also able to provide preventative healthcare, so helping our patients address those chronic healthcare conditions and address the healthcare needs that they might not otherwise get treated if they don't have a healthcare or a primary care home.
All you have to do is walk in. Organizers say there's no need for an appointment. And if you're concerned about payments,
We do not turn anyone away.
Hogue tells us they'll work with you to assure you get the care that you need, as they accept most insurances, including HMOs and Medicaid.
We're hoping to bridge the gap between access to healthcare and our community. So we're helping to provide healthcare to our underserved population, as well as address those social determinant of health needs such as food insecurity, homelessness, economic stability. We're hoping to bridge the gap.
For this week's Ask the Expert, I'm Kelsey O'Donnell. Remember, you can find all of these stories on our website, WSPA.com. Just click on the Ask the Expert section. Right now, we're going to take a quick break and return with more medical questions and answers. We want to continue now with a look at doctors and health experts answering your questions. This is 7 News Ask the Expert in partnership with Bon Secours St. Francis. Whether you're out grocery shopping, cleaning around the house, or competing in a sporting event, doctors say emergencies can happen to anyone, anywhere, at any time.
If you find yourself in an emergency, the first thing I would say is to try to stay calm, try not to panic, and to make sure you call 911 first.
Dr. Jay Blankenship has seen it all as an emergency medicine doctor. He says how you respond can often impact their response.
If you don't know how to respond to an emergency, the 911 operator and dispatcher often can give you advice and help coach you through the first steps to help provide care to the person who's in distress.
That's when CPR training, knowledge of AEDs, or even knowing how to use a tourniquet for serious bleeds will come in handy. Doctors say when bystanders help, your odds of making a full recovery increase.
Research suggests that out-of-hospital cardiac arrest survival rates with no bystander intervention is around 7 to 10%. However, when we see early intervention with CPR, those survival rates increase by around 40%, and research suggests that early defibrillation can increase survival rates by up to 70%.
Doctors say you should familiarize yourself with the Heimlich maneuver if someone begins choking, and understand the signs of stroke. Think, be fast.
We tell people to be fast. That's BEFAST. And that's an acronym that stands for balance, so acute change in balance. E stands for eyes, or acute loss of vision. F stands for face, or acute onset of facial droop. A stands for arm, or weakness in an arm or a leg. S stands for slurred speech. And T stands for time.
While things happen fast during emergency situations, medical professionals recommend trying your best to remember the steps you take, including the time and what happened leading up to the emergency.
You just never know when something like this is going to be a potentially life-saving knowledge. Could be for a family member, a friend, or even a complete stranger. But this training is extremely valuable and can truly make a big difference in someone's life.
For this week's Ask the Expert, I'm Kelsey O'Donnell.
I'm concerned about this.
Relieving your concerns and helping you get back on track after a cardiac event is a part of Hillary Joseph's job at Upstate Cardiology.
I primarily work inpatient in the hospital. I see patients when they come in during one of these crisis events, one of these cardiac events.
She's a part of a team of health experts that work directly with patients who suffered from heart attacks or failure, bypass surgeries, or even valve replacements.
Cardiac rehab expectations are threefold. One, you do physical exercise on treadmills, bikes, rowing machines. They do weight training, so things you would do in a typical gym. But then there's also the component of education by the dietitian for healthy diet and eating habits.
And that's when registered dietitians like Brianna Grand come in.
Our overall health and well-being really does revolve around a healthy diet and lifestyle.
As a cardiac rehab registered dietitian, Grand and a team of health experts at Bon Secours teach patients the importance of a healthy, well-rounded diet.
A healthy diet can prevent plaque formation. It can reduce your cholesterol and lower your blood pressure, which can also reduce the risk of future arterial blockages.
She says what you eat plays a big role in not only preventing cardiac events, but also how quickly you regain full strength afterwards.
To regain full strength can take some time.
Back at the rehab center, Joseph says health experts will work with patients as long as they are needed and noted that it may take less time if you stay on top of your symptoms.
We're really good at explaining our symptoms away. Oh, I just have a little heartburn. Oh, I might have pulled a muscle in my back. I'm just tired because I haven't been sleeping well. Oh, I had a little chest pain, but I ate something spicy. We can always explain away our symptoms, but when they recur and they happen over and over, it's time to go get checked out.
So if you think you have any of the symptoms Joseph mentioned, see a doctor, because the steps you choose to take could be what your life depends on.
Patients who undergo cardiac rehab have 30% reduced risk of fatal heart events, as well as a 25% reduced risk of dying just from completing the cardiac rehab program.
For this week's Ask the Expert, I'm Kelsey O'Donnell. Health experts say visiting a doctor of any kind can create unwanted stress or anxiety, and being referred to a cardiologist could get your heart racing.
So during the initial appointment, it's mostly fact-finding and listening on our part.
Dr. Jason Cuomo, an upstate cardiologist, also known as a heart doctor, is breaking down what to expect during your first visit.
So the cardiologist is going to ask you a lot of questions to try to get a sense for what kind of shape you're in, what symptoms you may be having, and whether you need any further testing, counseling, or advice.
While the reason for referrals can vary, doctors say there are some symptoms that raise red flags.
Most of the time, patients are referred to us with a symptom that's concerning for heart disease, and such symptoms include chest pain, shortness of breath, palpitations of the heart, or even loss of consciousness.
But medical professionals say physical symptoms are not the only reason to schedule an appointment.
So a patient with a strong family history of cardiovascular disease or other risk factors for heart disease would benefit from routine preventative care under a cardiologist. Not everyone needs to be seen.
Doctors say how often you visit will usually be determined during your first appointment.
It's going to depend on what we're treating, and if there's no active medical issue for us to take care of, it might be every 6 or 12 months. If there's an issue that's more acutely concerning, like if I'm trying to get your blood pressure under tighter control, I might bring a patient back every 2 to 3 weeks to do that.
Regardless of why you are referred to a cardiologist, doctors are hoping to ease some of your concerns. However, if you are experiencing extreme chest pain or severe difficulty breathing, health experts say it's best to go straight to the emergency room.
For chest pain lasting longer than 10 to 15 minutes, that's an ambulance call. For anything else, we're happy to pitch in.
For this week's Ask the Expert, I'm Kelsey O'Donnell. Don't forget to submit a health topic to our Ask the Expert series. Go to our website, click the news tab, and look for Ask the Expert. It's simple. More of your questions answered by our Bon Secours St. Francis medical experts after this. Welcome back as we continue to get answers to your various health topics. We continue now with our partners at Bon Secours St. Francis. This is 7 News' Ask the Expert.
The spine is really the cornerstone of the physical health of the body.
It's quite literally the backbone of our lives. Director of Bon Secours Pain Management, Dr. Daniel Atkinson, says spine health contributes to mostly all of our day-to-day tasks.
Cracks in that foundation can result in dramatic changes to how we function, how we move, and our comfort from a day-to-day standpoint.
So when things take a turn and stiffen up, challenges may arise.
We all have to understand that with life comes pains and aches, especially as we age. So as I mentioned already, over time the structure of the body loses that cushioning. It loses that pliability that we all love and appreciate. We don't bounce back like we used to.
Doctors say there are a number of different spine-related issues they see patients for, including arthritis, degenerative disc disease, stenosis, pinched nerves, fractures, and other conditions. But the good news, health experts say some of those are treatable.
There are certain conditions that we do treat, either procedurally or surgically. Some of them we talked about already, the disc pains, stenosis, pinched nerves, fractures. We can do things for those, but typically what we try to do first is treat the symptoms that occur secondarily due to those conditions. So in other words, when you have a disc herniation and it's pressing a nerve, what we try to do is alleviate some of that pressure by doing an epidural. Basically injections, nerve blocks.
While health experts say injuries and age play a big role, the best way to try to decrease your chances of having uncomfortable pain starts with good posture and living a healthy lifestyle.
So stretching, exercise, try to be active if you can be active. So if that's standing up from your desk from time to time while you're at work, moving the joints, stretching muscles, going for a walk at lunch.
And if your pain persists, be sure to see a doctor and do what's best for your body.
And I would say the last thing would be regular follow-ups with your health providers. So they're going to watch you, they're going to ask you questions, assess you, do tests. They'll come up with treatment plans initially. And at the end of the day, if those treatment plans don't get you to the point where you can function and do what you need to do, that's what we're here for.
For this week's Ask the Expert, I'm Kelsey O'Donnell. Getting your body ready for pregnancy may look different for each person, according to health experts with the CDC.
So general time frame is pretty individual. Most women start thinking about planning a pregnancy in their mid-20s. That's about the average, but we take care of pregnant women in their 20s, 30s, and even 40s.
Dr. Celeste Beaudoin, an OBGYN at Carolina's Women's Health, works directly with families for pregnancy planning.
As far as how long it can take to become pregnant, well, some couples it can take even up to a year.
Which is why she says it's important to start the planning process sooner rather than later, and that begins with seeing a doctor.
So coming in before you're thinking about starting the process is a good idea, just to make sure that you're not on any medicines that would hinder or be unsafe in pregnancy, and see if there's any health conditions that we can make sure that you're healthier with before starting.
Doctors say the mother's overall health is one of the most important parts of pregnancy. According to the CDC, smoking and drinking alcohol can cause issues, including birth defects, premature birth, and in worst cases, death. To ensure mom and baby get the proper nutrients, doctors recommend starting a vitamin.
It's always a good idea to be on prenatal vitamins before you start trying to get pregnant. At least a month is ideal. And so I usually tell women if they're going to stop their birth control, start taking a prenatal at least a month earlier than that. So making sure you're on one that has enough folic acid, at least 400 micrograms, sometimes more depending on your health, is a good idea.
Nutrition is not the only thing that mom should plan for ahead of pregnancy. Medical professionals say you should also keep an eye on your weight and prioritize moving your body.
So it's something that everybody has to talk about every time they come in, but at least having 30 minutes of exercise 5 times a week, somewhere between 150 to 200 minutes of exercise. If you can get in a regular routine of that and maintain a healthy weight while you're trying to get pregnant, then your pregnancy is going to go a lot smoother.
Overall health before pregnancy encompasses many things, even areas many tend to forget.
One thing that not everybody really thinks about is their dental health. And so not just seeing your doctor, but seeing a dentist and seeing if there's things that you can take care of, because we know that poor dental health contributes to a very high risk of preterm labor.
Whether you're pregnant or planning to grow your family soon, doctors say it's never too late to get back on track to prioritize your health for you and your baby. For this week's Ask the Expert, I'm Kelsey O'Donnell. From mood changes to hot flashes, doctors say menopause is a normal sign of women aging.
Menopause is a time in life, usually around age 45 to 50, that all women experience when they have hormonal changes that make it so that they're unable to bear children at that point.
Upstate cardiology physician assistant Kelly Valetti says during menopause, women produce less estrogen, which is what researchers are connecting to cardiovascular disease. Here's why.
The hormonal changes at menopause change how your body stores and utilizes fat, so that you tend to gain weight mostly with abdominal fat. You get some belly fat. And that is what increases your risk for cardiovascular disease.
Doctors say those changes have an impact on women's overall health because the more weight you gain, the more issues people tend to have with their arteries, blood vessels, and other implications that impact how the heart operates.
The main thing that women need to do as they go through menopause to minimize the symptoms that they experience and to decrease their cardiovascular risk are to know their blood pressure, their cholesterol numbers, and their blood sugar. The sooner you have that information, the more you can stratify your risk and start treatment.
To help with that, health experts recommend following a nutritious diet and prioritizing exercise.
Small changes are going to really help with decrease your cardiovascular risk. So if you normally eat 2 double cheeseburgers, if you can eat 1 and eat a little more vegetables with it, you have to know what is a reasonable goal for you. It's the same way with exercise. It's recommended to do 150 minutes of moderate aerobic exercise a week. But if you right now are only walking out to your mailbox once a day, a reasonable goal might be just walking to your mailbox three times a day.
According to the American Heart Association, heart disease is the leading cause of death among women in the U.S. And while it's not guaranteed you will develop cardiovascular disease during menopause, doctors say it's important to know the signs and how to maintain a healthy lifestyle. Even a small step in wellness is a step in the right direction. For this week's Ask the Expert, I'm Kelsey O'Donnell. That's a look at this week's Ask the Expert show here on WSPA Plus. Be sure to join us every Thursday on 7 News as we seek answers to your top health questions, and each week right here on WSPA Plus. For now, thanks for making an appointment with us.